Hello, my name is Dr. Jason St Clair. I'm a physical therapist and orthopedic clinical specialist. I'm hoping today to go through a few plank variations that might help a little bit for people who have low back or neck pain. So let's get to it. So when performing a traditional plank, often have people complain about low back pain. So I wanted to go over a modification that's a little bit easier to engage the abs and takes pressure off of the low back. And you still get that same burn that you're seeking when performing that activity. So the first level of bear plank I like to begin with for people who might have low back pain is a heel or foot referenced bear. For this, you'll place your heels flat against the wall. You'll have knees under hips, hands under shoulders. You'll tuck the pelvis a little bit, push the floor away, and gently lift the knees up off the floor. The foot reference helps engage your glutes and hamstrings on the backside, and then the bear position helps engage the abs. Those two things together create a lot of stability through the pelvis and thorax, and this usually really decreases the pain you might be having, and you still feel a tremendous amount of abdominals. All right, so a common finding whenever people are doing planks is that the back arches. So what we like to do is shorten the lever up and do what's called a bear plank. So you get in the all fours position and you'll have your knees under your hips, hands under your shoulders. And from there, you're just gonna imagine pushing the floor away and then gently lifting the knees up off of the floor. And we hold this position. Not having the wall reference makes you work a little bit harder to keep the abs engaged. So this would be considered a progression of the wall reference bear. So the final progression we'll go through today is a bear plank with alternating hand and feet taps. It's the same position, so you have hands under shoulders, knees under hips, push the floor away with your hands, tuck the pelvis under, and then you're just going to try to maintain a nice stable trunk and lift one hand, then the other, and then one foot, and the other. Try to cycle through 3 to 5 reps on each hand and foot. That should be about 30 seconds. You get a nice burn and maintain the tension in the abs. So neck pain is a common complaint when people perform side planks. One thing I find helpful to reduce that pain is to shorten the lever. So bringing the knees up closer to the body, still performing the side plank, and then to get a little bit more abdominal integration, you'll do a same-sided reach to tuck. As you tuck, you're gonna imagine curling, and that's gonna get, on my right side, the upside, get the abs even further engaged, all while getting the benefits of the side plank on my bottom arm. Keep the neck relaxed, and usually this is a great option. So once again, low back pain is something frequently that is reported when doing planks. So a few things just to summarize. I would switch to try a bear plank, start with the first progression and work your way through. The goal is to maintain tension in the abs and not have any low back discomfort throughout the exercise. If you have any questions, I'd be happy to answer and look forward to the next one.